Contents of this video. This video will highlight some of the important aspects of flu or influenza infections, signs and symptoms, complications, treatment, how to diagnose flu infection, similarities and differences between flu, coronavirus and common cold infections. We will also explain in brief why flu and other respiratory infections are more common in winter season and what measures we can take to stay away from flu or other respiratory tract infections. We can reasonably say that after watching this video, you will be able to better prepared for the flu season in future. What is influenza? Influenza, or flu, is a highly contagious respiratory illness that spreads easily through the air, droplet infection, or contact with contaminated surfaces. The flu, a viral infection, typically resolves on its own, but certain groups may experience severe complications. Initially thought to be caused by a bacterial infection, but viruses as the cause were later identified in the 1930s. The flu can cause mild symptoms like chills, fever, and fatigue, and can also result in serious complications, especially in vulnerable individuals. The most common complication is pneumonia, usually caused by a secondary bacterial infection. Flu viruses mutate rapidly, leading to various strains, including influenza A and B. The flu is a highly contagious disease that can cause serious complications, especially in vulnerable groups like elderly, diabetics, infants, immunocompromised, those on cancer chemotherapy or chronic steroid use. History of influenza A and Old Menace. The 1918 H1N1 influenza pandemic, also known as the mother of all pandemics, infected 500 million people worldwide, killing 20 to 50 million. The high death rates led to a drop in life expectancy and more deaths than the entire First World War. Researchers in the US and Europe attempted to find an effective vaccine but failed to target the correct pathogen. Discovery of influenza vaccine and continuing efforts for tracking influenza strains. In 1933, British researchers isolated and identified the influenza virus, leading to the development of the first inactivated flu vaccine. The U.S. Army supported the vaccine, which was tested for safety and efficacy before being licensed for wider use in 1945. Researchers suspected different types of influenza viruses, including influenza B. In 1942, a bivalent vaccine was developed against both H1N1 and influenza B. In 1947, existing vaccines were ineffective against flu viruses. The World Health Organization established the Worldwide Influenza Center and the Global Influenza Surveillance and Response System to monitor and update vaccines. Efforts to track flu virus evolution continue today, with seasonal and potentially pandemic strains changing annually. Who recommends virus strains for inclusion in flu vaccines? Why influenza and other respiratory infections are more common in winter season. We will explain the scientific reason and mechanism why this happens. Cold and flu season is characterized by sudden sneezing, sniffling, or worse, as germs are present year-round. The traditional belief is that cold and flu season occurs during cooler months due to increased indoor confinement, making it easier for airborne viruses to spread. Scientists have discovered that the cold air damages the immune response in the nose, leading to more respiratory illnesses in winter. This breakthrough reveals that the cold air itself is the biological reason we get more respiratory illnesses in winter, as it is the first blast of winter weather. A 2022 study published in the Journal of Allergy and Clinical Immunology found that reducing the temperature inside the nose by as little as 9 degrees Fahrenheit kills nearly 50% of the billions of helpful bacteria-fighting cells and viruses. Cold air is associated with increased viral infection, as half of immunity is lost. Researchers at Northeastern University in Boston discovered that when a respiratory virus or bacteria invades the nose, the front of the nose detects the germ before the back of the nose is aware. The cells lining the nose create billions of extracellular vesicles, EVs, which act as decoys to kill the virus. These EVs are expelled into nasal mucus, where they stop invading germs before they can multiply. Once created, the billions of EVs swarm the germs, mowing up the inhaled viruses so they can never get into the cell. A study found that the nose increases the production of extracellular vesicles by 160% when under attack and has more receptors on their surface than original cells. These extracellular vesicles have up to 20 times more receptors on their surface, making them super sticky. The nose also contains 13 times more microRNA sequences than normal cells. However, when exposed to cold air, the temperature in the nose can drop by up to 9 degrees Fahrenheit, knocking out all three immune advantages. This results in nearly 42% of extracellular vesicles being out of the fight and a 70% drop in receptors on each vesicle. The pandemic has provided us with the necessary tools to combat cold air and maintain high immunity. Wearing masks not only protects against direct virus inhalation but also acts as a sweater on the nose, enhancing the effectiveness of our innate immune defense mechanism. Symptoms of influenza. Influenza, a viral infection, can cause mild to severe illness and even death. Symptoms typically manifest suddenly, including fever, cough, sore throat, runny nose, muscle or body aches, headaches, fatigue, and vomiting and diarrhea, particularly in children. It's important to note that not everyone with flu will experience a fever. Complications of influenza. The flu typically recovers within a few days to less than 2 weeks, but some individuals may develop life-threatening complications, such as pneumonia, which can result from either flu virus infection alone or co-infection of flu virus and bacteria. Other serious complications include heart, brain, muscle tissue inflammation, and multi-organ failure. The respiratory tract infection can trigger an extreme inflammatory response, leading to sepsis, the body's life-threatening response to infection. Flu can also worsen chronic medical problems, such as asthma attacks and worsening of heart disease, such as those with asthma or chronic heart disease. Overall, flu can be a significant health risk for individuals. Warning signs of influenza patients for urgent medical care. Children should seek medical care immediately if they experience signs of a severe illness, such as fast breathing, bloating, chest pain, severe muscle pain, dehydration, seizures, fever above 104 degrees Fahrenheit, fever or cough that improves but returns or worsens chronic medical conditions. These symptoms should be addressed immediately to prevent further complications. Adults experiencing warning signs of respiratory distress should seek immediate medical attention, including difficulty breathing, persistent chest or abdominal pain, dizziness, seizures, non-urination, severe muscle pain, weakness, recurrent fever or cough, and worsening of chronic medical conditions. How can I know if I have the flu? Flu is a respiratory illness characterized by fever, cough, sore throat, runny nose, body aches, headache, chills, and fatigue. It can also cause vomiting and diarrhea, especially in children. Flu symptoms can occur without a fever and are most common during colder months. However, flu can occur outside of the typical season and other viruses can cause similar respiratory illnesses. It is impossible to determine if you have flu based on symptoms alone, but laboratory tests can help determine if you are sick with flu. Testing for influenza. Rapid influenza diagnostic tests, RITs, detect the virus's antigens, providing results within 10 to 15 minutes. Rapid molecular assays detect genetic material, producing results in 15 to 20 minutes. Other accurate tests require specialized laboratories like RT-PCR, viral culture, and immunofluorescence assays. These tests require a healthcare provider to swab the inside of the nose or throat, and results may take 1 to several hours. During a flu outbreak, a positive rapid flu test indicates infection. However, rapid tests' ability to detect flu viruses varies, and children are better at detecting it. This can result in false negative results, but healthcare providers can diagnose flu based on symptoms and clinical judgment. Difference between influenza and COVID-19. Coronavirus infection. Influenza and COVID-19 are contagious respiratory illnesses caused by different viruses. COVID-19 is caused by SARS-CoV-2, while flu is caused by flu viruses. COVID-19 spreads more easily than flu, making it crucial to increase vaccine uptake everywhere in the world. COVID-19 can cause more severe illness and take longer to show symptoms. Specific testing is needed to diagnose and treat both viruses, and early treatment can reduce the risk of severe illness. Testing can also reveal if someone has both flu and COVID-19 simultaneously, potentially leading to more severe disease. Similarities between influenza and COVID-19 infection. COVID-19 and flu share common symptoms such as fever, cough, shortness of breath, fatigue, sore throat, runny nose, muscle pain, headache, vomiting, diarrhea, and loss of taste or smell, with flu more common in children. COVID-19 and flu viruses can be infected for days before symptoms appear, and it's possible to be infected without experiencing symptoms, while flu viruses can also be infected without any symptoms. COVID-19 and flu can spread through close contact, mainly through large and small particles expelled during coughing, sneezing, or talking. These particles can land in nearby people's mouths or noses and potentially inhale into the respiratory tract. In indoor settings with poor ventilation, small particles can spread longer distances and cause infections. Both COVID-19 and flu can cause severe illness and complications, particularly in older adults, those with underlying medical conditions, and pregnant individuals. Both COVID-19 and flu can cause complications such as pneumonia, respiratory failure, acute respiratory distress syndrome, sepsis, cardiac injury, multiple organ failure, worsening of chronic medical conditions, inflammation of the heart, brain, or muscle tissues, and secondary infections. These complications can be life-threatening due to the body's extreme response to an infection. Differences between influenza and COVID-19 infection. COVID-19 symptoms may take longer to develop than flu symptoms, which typically appear 2 to 5 days after infection and can persist up to 14 days after infection, compared to flu symptoms which typically appear within 1 to 4 days. COVID-19 can be contagious for longer than flu, with individuals potentially being contagious for about 1 day before symptoms appear. Flu is mainly spread by symptomatic individuals, with older children and adults most contagious during the first 3 to 4 days. Infants and those with weakened immune systems can be contagious for even longer. COVID-19 can be spread without symptoms. COVID-19 is a more contagious virus than flu, with more super-spreading events and rapid spread. It can be spread by people before symptoms appear, mildly symptomatic individuals, and asymptomatic individuals. This makes it easier to spread and results in continual spread over time. The virus can also be spread by asymptomatic individuals. COVID-19 causes severe illness in some individuals, leading to hospitalization and death even in healthy individuals. Some COVID-19 patients may develop post-COVID conditions or multisystem inflammatory syndrome, MIS. Flu is a common cold that typically recovers within a few days to 2 weeks, but some individuals may experience severe complications requiring hospitalization. Secondary bacterial infections are more common with flu than COVID-19. Diarrhea is more common in young children with flu than in adults. COVID-19 can cause blood clots in the lungs, heart, legs, or brain, and multisystem inflammatory syndrome in children, MIS-C, and in adults, MIS-A. Anyone who has experienced COVID-19 can experience post-COVID conditions, which can last weeks or months after infection or appear weeks after infection. Difference between influenza and common cold. Influenza and the common cold are contagious respiratory illnesses caused by different viruses. Flu is caused by influenza, while the common cold can be caused by various viruses including rhinoviruses, parainfluenza, and seasonal coronaviruses. Flu is generally worse and more intense, while colds are milder and do not cause serious health problems. Seasonal coronaviruses should not be confused with COVID-19. Treatment of flu. If your child gets the flu, provide them with plenty of liquids, encourage rest, and dress them in layers. Give acetaminophen or ibuprofen for fever and aches, but avoid aspirin unless prescribed by a doctor. Over-the-counter cough or cold medicines should be given to children over 6 years old, but not to children under 6 due to potential reactions. Use a cool mist humidifier to relieve coughs and runny noses. Honey can help loosen a stubborn cough in children over 12 months old. For a stuffy nose, use salt water and saline nasal spray. Get the flu vaccine yearly for everyone older than 6 months and wash your hands frequently. Children should stay home until they feel better or have been fever-free for at least 24 hours. Influenza antiviral drugs, oseltamivir, can be a treatment option for flu, especially when started early. High-risk individuals include young children, adults 65 and older, pregnant women, and those with certain medical conditions. Treatment works best within 1 to 2 days, reducing symptoms and shortening illness duration by about a day. About flu vaccination, the CDC recommends annual flu vaccination for individuals aged 6 months or older to prevent the flu and its complications. Although not 100% effective, the vaccine can lower the risk of severe illness, hospital stays, or death from the flu. Timing of flu vaccination. The flu vaccine, produced by private manufacturers, takes 6 months to produce and is typically available in August in most parts of the world. Healthcare professionals can start vaccinating people as soon as it becomes available. It takes up to 2 weeks to build immunity, and it's best to get the vaccine in September and October, with an aim to get it by the end of October. Need for annual flu shots. The flu vaccines are updated annually to keep up with rapidly changing flu viruses. The immune system produces antibodies to protect against the vaccine-included viruses, but these levels may decline over time, making it essential to get a flu shot every year. Who should get annual influenza vaccination? The CDC recommends annual influenza vaccinations for individuals aged 6 months or older, as the vaccine reduces the risk of severe complications from infection. High-risk groups include adults over 65, those in nursing homes or long-term care, young children, and pregnant or recently pregnant individuals. Certain groups have a higher risk of hospital treatment for flu. Other high-risk groups include those with weakened immune systems, a BMI of 40 or higher, nervous system disorders, chronic illnesses, strokes, and those receiving long-term aspirin therapy. Children aged 6 months to 8 years may need 2 doses of the flu vaccine, given at least 4 weeks apart, and can receive single annual doses. If you have a severe reaction to a previous flu vaccine, consult your healthcare team before receiving the vaccine. If you have egg allergy, you can still get the flu shots. Effectiveness of flu vaccine. The flu vaccine's effectiveness varies, with standard vaccines being more effective for individuals under 65. High-dose vaccines are approved for those 65 and older, enhancing immune system response. Studies show flu vaccines lower the risk of illness by 40% to 60% when matched to flu viruses. Vaccination is crucial for both COVID-19 and flu, as they cause similar symptoms. Vaccination can be combined with COVID-19 vaccinations in one visit. How can we avoid getting influenza or other respiratory droplet infections? The flu vaccine is the best defense against the flu, but other steps to protect yourself include washing your hands frequently, keeping your hands away from your face, avoiding crowds, covering your mouth when coughing or sneezing, cleaning and disinfecting commonly touched surfaces, practicing good health habits, and avoiding close contact with sick people. Washing your hands with soap and water for at least 20 to 30 seconds and using alcohol-based sanitizer if soap and water aren't available can help prevent the spread of the flu. Cover your mouth with a tissue or the inside of your elbow when coughing or sneezing. And wash your hands after. Regularly cleaning and disinfecting commonly touched surfaces can help prevent the spread of infection. Practicing good health habits, such as exercise, sleep, fluids, diet, and stress management, can also help prevent the spread of the flu. Staying home and away from others can help prevent the spread of the flu. Natural home remedies for flu infection. Natural remedies like honey, salt water, and herbs can alleviate sore throat symptoms, but if they don't improve, medical care or OTC medications may be necessary. Honey is a common remedy for sore throats and is effective in treating coughs in children, similar to dextromethorphan. Honey is more effective than antibiotics and diphenhydramine in relieving symptoms. Gargling with warm salt water can soothe a sore throat, reduce bacteria, and break down secretions. The American Osteopathic Association recommends saltwater gargling at least once an hour. Gargling with a baking soda saltwater mixture can relieve sore throats by reducing bacteria and preventing fungi growth. The National Cancer Institute recommends using this solution 3 or 4 times daily, followed by plain water rinse. Chamomile tea, known for its soothing properties, has been used for medicinal purposes, including treating sore throats, due to its anti-inflammatory, antioxidant, and astringent properties. Peppermint is known for its breath-freshening, anti-inflammatory properties, and menthol-containing properties. It can be used to make teas or create diluted peppermint oil sprays to relieve sore throats. Both teas and sprays can be made by combining peppermint oil with plant-based oils like olive oil, almond oil, and coconut oil. Fenugreek, a herb with healing powers, can be consumed in various forms like seeds, oil, or tea. It can relieve pain, reduce inflammation, serve as an antifungal, and promote lactation. However,
pregnant people and children should avoid large doses.
Marshmallow root, an herb with mucilage, can soothe a sore throat and is available in various forms like tea, tincture, dried, and capsule form. Licorice root tea is effective in treating sore throats, inhibiting Streptococcus pyogenes growth. It can be used as lozenges or gargles before surgery but may not be safe for pregnant or nursing individuals.
Slippery elm, a traditional remedy for sore throat, contains mucilage and forms a slick gel when mixed with water.
It can be used as lozenges or a supplement, but further research is needed. Garlic, rich in allicin, has natural antibacterial properties and can be used to prevent and treat upper respiratory tract infections. Chicken soup is a popular remedy for respiratory and throat conditions, according to a 2000 study. The study found that chicken soup inhibited the migration of neutrophils in a dose-dependent manner, with different brands having different inhibitory effects. Additionally, chicken soup may provide psychosocial benefits and help in healing. Dry air can irritate a sore throat, so adding moisture like steam can help ease it. Rest and ensure adequate sleep when experiencing a sore throat, as sleep loss can increase infection risk and inflammatory proteins. Avoid loud talking, singing, or shouting, as these actions may further irritate the throat.